Hello, everybody. My name is Christopher, and I'm talking to you guys about medical assessment today. First of all, foremost of any call, you always have to make sure you have your PPE on, which would be like gloves, a mask, goggles, sometimes the apron. Just depends on what kind of scene you're gonna go to, but you always have to have personal protective equipment. Second note is that you always want to listen to what the dispatcher actually gives you, your information, such as number of patients, how many people there are, if it's like a mass casualty or if it's just one person. Listen to what kind of chief complaint it is, whether if it's medical or trauma, what you have to be prepared for, nature of illness or mechanism of injury. Listen for that. Um, where you're located or your location is, where you're headed to. Uh, your safety always comes first as the EMT. You always have to keep yourself in mind before anything else. So if you're getting called somewhere dangerous late at night, you always have to keep that in mind of your precautions of going into a house or going into an apartment or anything. You always make sure you want to have APD or your available resources such as fire, or if you're in the desert area, like in a hiking area and you need a helicopter or better equipment, make sure you have knowledge of what available resources you have at the moment. And pulling up to your scene, you have your windshield view. Make sure you document everything, make sure you get everything. Take under consideration what the outside of the house looks like, the fence area, is there dogs, anything dangerous, the neighbors, are they looking dangerous, like anything that could be a hazard to your safety. And then once you actually go into the house, you get greeted by the patient, evaluate the house as you're walking through it, see what kind of house it is it clean, picked up, well kept, or is it dirty, dark, stuff thrown around, everything. Just what kind of things do you see? And when you're approaching your patient or patients, you evaluate of what their body tone is or what's around them. Your general impression is what you first see. So like their skin color, if it's cool, pale, clammy, or if it's pink, warm, and dry, you have to know that. If they're unconscious, you want to go for a pulse right away and make sure they're alive. You could check at the carotid right here, the radial right at the wrist. Always check with your fingers, not your thumb or anything, because your thumb gives off its own pulse. Uh, when you're doing your assessment, you're gonna go down. If they're unconscious, you're gonna load and go and see if there's any life-threatening. When you're walking upon a patient, you always want to stop the life-threatening, such as if they can, like if a patient can't breathe, if they're having respiratory distress. You want to fix that problem and then move on to anything else. Get them to be able to breathe. Oxygen with either a nasal cannula at 1 to 6 liters per minute, a non-rebreather at 10 liters to 15 liters per minute, or if they're unconscious with the BVM, because you have to bag for them, with 15 to 25 liters per minute, 100 full oxygen. Just make sure they could breathe. Any bleeding, make sure you stop the bleeding, control, and move forward. If they're conscious and they can actually talk to you, then get some knowledge from them, such as like a sample. So sample is S, signs and symptoms. So what are they showing? How are they showing it? What is their chest complaint? So if they say in their chest, like, what is their signs? Like, is it chest pain or is it like breathing pain? Uh, Allergies for A. So if they're any allergic to anything, any medications or anything. M is any medications they've been taking or if they're currently taking them. P is past medical history. Make sure you get what they've been through before, because it could be the same thing as what they've been through before if it's a medical scenario. L is last oral intake. When did they last eat? Um, E is what were the events leading up to this? What were they doing with chest pain? Were they doing certain things like activities or just hanging out on the couch? OPQURST. You want to take that? It's O is onset. So what? It's pretty much like event. Like what were the events leading up to it? Provocation is I'm not sure on provocation. Okay. Quality. So the pain is like what kind of quality it is. Like if it's sharp, dull, fire. Like what kind of quality it is. Radiation. If it's radiating. So if it's chest pain, like as a heart attack, it'll go up to the jaw, the right side or the left side of the face, down the left side of the arm. Like it radiates like that. Severity. Is like a scale from 0 to 10 because people kind of have zero pain. OPQRST. Time is like the time leading up to it. What time did it begin? And U is has this ever happened to you before? And then you'll make your rule out, and when you call your either ALS or the hospital that you're taking them to, you just want to make sure you fill out all your vitals when you're telling them, like do right away your chief of complaint, age, gender, what you've done for them, how far you are from them, state all their vitals and what condition they're in, and if they have any questions, and just keep reassessing your patient.